A new report out of Los Angeles County has revealed that fentanyl has surpassed methamphetamine as the area's deadliest drug. The Los Angeles County Department of Health found more than 1,600% increase in accidental fentanyl overdose deaths, or as some call them, poisonings, since 2016. That is 109 deaths in 2016 compared to more than 1,900 in 2022. Dr. Gary Tsai joins us now. He's the director for Los Angeles County Department of Public Health, Substance Abuse Prevention and Control. Dr. Tsai, as I mentioned, poisoning is because I've interviewed so many people who, their loved ones were killed because of a fentanyl overdose where they didn't know it was fentanyl. Talk to us about what you found and what the report found about as to why these spikes have happened.
Yeah, unfortunately, we're in the most tragic crisis in terms of overdoses. Fentanyl is a major contributing factor to that. It's increasingly being found in the illicit drug supply as well as in counterfeit pills. And so people sometimes are taking pills that they're acquiring from places other than a doctor's office or a pharmacy, and unfortunately are being poisoned and being exposed to fentanyl unknowingly. We've had more overdose deaths over the past year since we've seen ever before. And unfortunately, while the numbers seems to be slowing, it's still going up.
One thing that people always ask me in having covered the war on drugs and how different things are now with fentanyl is why? Why is it that fentanyl ends up in not just people who are seeking out fentanyl, but in other drugs? What's the reason behind this, from what you know from your medical perspective?
Well, fentanyl is relatively easy to make, and it's relatively cheap to make. And so putting it into the drug supply can have more people who are dependent on this substance. That's relatively easy to make and to grow very quickly.
So the report found that the issue is hitting Black communities hardest. Why is that?
While Black populations in Los Angeles County represent less than 10%, they represent more than 20% of overdose deaths and more than 30% of people experiencing homelessness. Homelessness is a major driver of risk, as are people who use drugs. We also have a lot of work to do to ensure ready access to naloxone, which is the opioid overdose reversal medication, across all communities, including communities where we have more individuals who are Black or brown.
It's also found that more affluent areas and there have been higher numbers of overdoses in more affluent areas as well. Can you walk us through those numbers?
Yeah, I mean, this stems back to the opioid epidemic, where individuals, sometimes in more affluent areas, had access to opioid pain medications. That's continued to more and more powerful or potent opioids, including fentanyl. We're also, as mentioned, finding fentanyl more and more in counterfeit pills, which affluent areas may have access to.
I see. Well, Dr. Gary Tsai, thank you so much.
Thanks for having me.